Hello, healthcare heroes. Welcome to the new episode of OneMedPro Pulse, your go-to podcast for all things healthcare. We couldn't be more thrilled to have you join us on this journey. This podcast is dedicated to you. We know your work is critical, and our goal is to empower you with the latest industry insights, marketing strategies, and tools to thrive in your practice or organization. Whether you're looking to grow your practice, connect with patients in meaningful ways, or simply stay informed about the latest trends, OneMedPro Pulse is here to inspire, educate, and connect. So, grab your stethoscope or your earbuds, and let's dive into the heartbeat of healthcare innovation.
Welcome back to OneMedPro Pulse podcast today. We're going deep into the must-have traits for leadership and management to really succeed in India's healthcare industry. Yeah, it's a fascinating area. And we'll be looking at a OneMedPro blog post for this. It's titled, Developing Leadership and Management Careers in India's Healthcare Industry, Success Traits. It came out pretty recently, August 17th of this year. Whether you're already a leader or on your way there, this deep dive is full of insights to help you navigate this world.
Absolutely. This post really gets to the heart of it. The unique skills you need to excel in India's healthcare. It's not just about the clinical side. It's about leading with empathy, communicating really well, and creating a culture of always getting better.
Okay, let's break that down a bit. The blog starts strong, emphasizing empathy. It's interesting. They don't see it as just a nice to have, but as a core skill for patient-centric care. Why is that, do you think?
Well, you see, in India, we have a huge and diverse population. Everyone has unique needs and expectations. Empathy lets healthcare leaders connect with patients more deeply, understand their concerns, and build that trust. This is so important, especially in a system where patients rely heavily on their providers.
Right, makes total sense. And it's not just about being friendly. There's research to back this up. The Institute of Medical Sciences in Banaras Hindu University, they found that empathy directly relates to higher patient satisfaction and trust.
Exactly. When patients feel heard and understood, it makes that patient-provider relationship so much stronger. They're more likely to follow treatment plans and ultimately have better outcomes. And this isn't just limited to patient care. Empathetic leadership is crucial when managing teams as well.
That's a great point.
Yeah.
So how can a leader demonstrate empathy in a real way, say in a tough situation, with a patient or even a stressed team member?
Let's say a patient is really anxious about a complicated procedure. An empathetic leader wouldn't just focus on the clinical stuff. They'd acknowledge the patient's fear, explain the procedure clearly, and address their concerns with patience and understanding. It's about seeing things from their side and responding with genuine compassion.
It's that human connection, right? Putting yourself in their shoes and acknowledging their feelings. You mentioned teams. How does empathy translate to leading a team?
Well, hospitals can be high-pressure environments. It's easy for team members to get overwhelmed or burned out. An empathetic leader recognizes this and creates an environment where everyone feels valued and respected. This could be actively listening to their concerns, offering flexibility, or simply acknowledging their hard work and dedication.
It creates a more positive and collaborative work environment, which leads to another trait from the blog, effective communication. What makes it so vital, especially for patient safety, like the post mentions?
Clear and accurate communication. It's absolutely crucial in healthcare. You know, the Indian Journal of Medical Ethics, they published a study showing how miscommunication can lead to medical errors and jeopardize patient safety.
I see. A simple miscommunication in a complex procedure or a handover could have serious consequences.
Exactly. And in India's healthcare landscape, it's getting more diverse and interconnected. Communication skills are more vital than ever. Leaders need to bridge language barriers, ensure clarity with patients from all backgrounds, and foster collaboration in these diverse teams.
So how can healthcare leaders, especially with diverse teams, overcome these barriers and make sure everyone is on the same page?
One approach is clear communication protocols, hospital-wide or within the clinic, using standardized terminology, checklists for critical procedures, and regular team huddles to keep everyone informed. Technology can play a part too. Translation apps or visual aids can bridge those language gaps and help explain complex medical information.
Those are practical solutions. That can really make a difference. And it's not just about the tools, it's about creating a culture of open communication where everyone feels comfortable speaking up, asking questions, and sharing their perspectives.
Yes, Fostering that dialogue is key. And that brings us to another crucial aspect: problem solving. The blog highlights the many challenges for healthcare leaders in India. Things like limited resources and rapidly changing technologies.
Definitely constant hurdles. The Journal of Health Management, they did a survey linking effective problem solving to better operational efficiency and ultimately better patient care. It's not just putting out fires, it's about proactively addressing these systemic issues, right?
Exactly. Leaders need to move beyond just reacting. They need to develop strategies to anticipate problems and address them proactively. This could involve optimizing resource allocation, implementing new technologies effectively, or streamlining workflows to improve patient flow and reduce those wait times.
So thinking strategically, coming up with creative solutions to complex challenges. What would be a real-world example of a healthcare leader in India successfully showing this problem-solving skill?
A great example is the rise of telemedicine, especially in rural areas. Leaders who saw the limited access to specialists in remote regions and implemented telemedicine solutions. They're not just putting out fires, they're transforming healthcare and making a real impact on people's lives.
That's fantastic. How innovative problem-solving can bridge those gaps.
Yeah.
And improve access. Thinking outside the box. Finding solutions that benefit the whole system. Speaking of supporting the system, the blog emphasizes mentorship. Why do you think they see it as a responsibility, not just a perk, in India's healthcare?
Mentorship is so important. For the professional growth of healthcare professionals in India, it's not about climbing the ladder. It's about building a culture of learning and sharing knowledge. The International Journal of Community Medicine and Public Health, they did some research, that showed a strong link between mentorship and job satisfaction. For those in healthcare,
makes sense. Healthcare is demanding. Having a mentor to guide you, offer advice, share their experience can be invaluable. But how can leaders really invest in their junior staff and pass on their knowledge to create a skilled workforce?
It begins with a genuine commitment to developing the next generation of leaders. This could be setting up formal mentorship programs in hospitals, providing opportunities to shadow experienced professionals, or just being available to offer guidance and support.
Structured programs, shadowing, one-on-one guidance, all great ways to make sure mentorship is happening.
Yes, and mentorship is a two-way street. Leaders can learn from their mentees too, getting fresh perspectives on the challenges faced by those new to the field.
A continuous exchange of knowledge and experience benefits everyone. Speaking of continuous learning, the blog really stresses its importance for good leadership in India. What are your thoughts on that?
The healthcare world is always changing. New discoveries, technologies, treatments, all the time. Leaders need to stay updated, not just for their own growth, but to lead their teams effectively and provide the best possible care.
Easy to get caught up in the day-to-day, but continuous learning is essential, especially in such a dynamic field.
The Indian Journal of Pharmacology, they published a study that showed how ongoing education raises healthcare standards. It's about always seeking new information, conferences, courses, reading industry publications.
So staying curious, committed to lifelong learning. And as a leader, it's not enough to just learn yourself. You need to cultivate that in your team.
Absolutely. Leaders should encourage their teams to pursue education, give them the resources and time to do it, and create an environment where knowledge sharing is valued. This could be journal clubs, case discussions, even inviting guest speakers to share their expertise.
So embedding learning in daily operations, making it central to the team.
Exactly. Leading by example is also key. If the team sees their leader actively learning, they're more likely to embrace it themselves.
Setting the tone, fostering that culture of always getting better. But sometimes staying ahead of the curve takes more than just keeping up with research. It requires challenging the status quo, another key trait from the blog. What are your thoughts?
Challenging the status quo. It's essential for driving innovation in healthcare, questioning existing practices, asking, is there a better way? Or can we use technology to improve care?
That critical thinking mindset, willing to push the boundaries, right?
Exactly. In India, we have unique challenges, limited resources, a huge population to serve. Innovation isn't a luxury, it's a necessity. The Indian Journal of Surgery, they did a study highlighting how important it is to embrace new technologies and practices to really move healthcare forward.
So how can leaders create this culture of improvement and encourage their teams to push those boundaries?
It starts with creating an environment where people feel comfortable sharing their ideas, even if they challenge the norm. Leaders should actively ask for feedback, encourage experimentation, and be willing to take calculated risks. Celebrating successes, big or small, is also key.
Creating a safe space to think creatively. Challenge existing norms, even if it means making mistakes.
Exactly. Mistakes are opportunities to learn and improve.
This has been a fantastic conversation. We've covered so much: empathy, effective communication, problem solving, mentorship, continuous learning, challenging the status quo.
And they're all interconnected, building on each other to create well-rounded, effective leaders.
It's not about picking one or two. It's about a holistic approach. That includes all these qualities.
Absolutely. And remember, these aren't just traits for senior leaders. They're valuable for everyone in healthcare, regardless of their role.
Great point. So, for our listeners out there, whether you're a doctor, nurse, technician, or administrator, think about how you can use these traits in your daily work, your interactions with colleagues. It's about building a more compassionate, efficient, and innovative system in India, one interaction at a time. We'll be back after a short break
to explore some real-world uses of these traits. Stay with us. Welcome back to the OneMedPro Pulse podcast. Before the break, we were talking about these 6 essential leadership traits for succeeding in India's healthcare industry. Now, let's dive a little deeper into how these traits actually work in everyday situations.
Right. It's easy to talk about them generally, but what does it really look like to put them into practice? Let's start with empathy. We discussed how important it is for patient interactions. But how can a leader really show empathy, especially in a challenging moment?
Okay, imagine a patient is getting some tough news about their diagnosis. An empathetic leader wouldn't just deliver the information coldly. They'd acknowledge the patient's feelings, maybe say something like, "I can see this news is upsetting. What are you feeling right now?"
Validating their experience.
Yeah.
Recognizing that it's not just medical facts, but also about the emotional impact.
Exactly. It's about giving them space to
Right.
process their emotions and feel heard. Even a small gesture, like a hand on their arm or making eye contact, can convey empathy and build that connection.
Those small things can mean so much. Okay, let's shift to effective communication. We talk about how important it is in India's diverse healthcare setting. How can leaders make sure communication is clear, especially with language barriers or cultural differences?
One strategy is using visuals, charts, diagrams, even simple drawings. They can help explain complex medical information in a way that goes beyond language. For example, if you're explaining surgery to someone who doesn't speak the same language, a diagram can illustrate the process.
That's a great point. Makes the information more accessible.
Yeah.
Reduces the risk of misinterpreting something.
Exactly. And it's also important to be mindful of cultural nuances in how people communicate. Some cultures value directness, others prefer a more indirect approach. Being sensitive to these differences can prevent misunderstandings and help build rapport with patients from different backgrounds.
Being culturally sensitive. Adapting your communication style. It sounds like active listening is crucial too.
Absolutely. Active listening means not just hearing the words, but also paying attention to nonverbal cues, body language, facial expressions. And it means asking clarifying questions to make sure you've understood correctly, especially in a multicultural setting. Being a good listener can avoid miscommunication and build trust.
Going beyond the surface, really understanding the message, both what's said and what's not said. Let's move on to problem solving. Healthcare leaders in India face so many challenges. Resource limitations, the constantly changing technology. How can they tackle these with a problem-solving mindset?
Leaders need to create a culture of problem solving within their teams. This means giving team members the power to identify challenges, brainstorm solutions, and take ownership of the process.
Shifting from a top-down approach to a more collaborative one.
Exactly. One way to do this is through regular brainstorming sessions. Team members from different departments can come together, discuss the challenges, and come up with innovative solutions.
Bringing diverse perspectives together, tapping into the team's collective intelligence.
Precisely. And remember, problem solving isn't always about finding the perfect answer immediately. It's about making small improvements, testing different things, and learning from both successes and failures.
Embracing that process and using it as a learning experience.
Yeah.
Now, about mentorship. It was another key point in the blog. How can healthcare leaders effectively mentor their junior staff and help them develop their own leadership potential?
Mentorship is all about sharing your knowledge, your experience, your insights, to guide someone's professional growth. Being a sounding board, offering advice, providing support.
So building a good mentor-mentee relationship is essential.
Absolutely. It's more than just scheduling meetings. It's about creating a space where the mentee feels safe, sharing their aspirations, challenges, and concerns.
Building that trust. Creating a relationship that encourages open communication. and growth.
Exactly. A good mentor doesn't just tell their mentee what to do. They listen, they ask questions, they help the mentee find their own path.
Guiding them, not dictating the route.
Precisely. And mentorship isn't one size fits all. Different people have different needs, different learning styles. A good mentor adapts their approach to meet those individual needs.
Great point. Now, on to continuous learning. We discussed how important it is to stay ahead of the curve in healthcare, but how can leaders make this happen in a busy environment?
It starts with making learning part of the daily work. Encourage team members to attend conferences or workshops, subscribe to journals, even set aside time for team discussions on new research or clinical advancements.
Making learning part of the culture, not just an occasional thing.
Exactly. Leaders can also encourage using online learning platforms. They're flexible and accessible, a great way to stay up to date on the latest in healthcare.
Convenient for busy schedules. But it's not just about gaining knowledge, it's about using it, right?
Absolutely. Leaders should create opportunities for teams to share what they've learned, discuss how to apply it to patient care, or to improve processes. This could be case studies, journal clubs, presentations during meetings.
Creating a feedback loop, where learning leads to action and improvement.
Exactly. And leading by example is so important. If the team sees their leader actively learning, they're more likely to do it themselves.
Setting the example. Showing that continuous learning matters. Finally, let's talk about challenging the status quo. In a field that's often bound by tradition and rules, how can leaders foster innovation?
It starts with an environment where people feel comfortable sharing ideas, even if those ideas are unconventional, or challenge the norm.
Encouraging that creativity, making it safe for people to think outside the box.
Exactly. Leaders should be open to trying new approaches, even if they don't always succeed.
Embracing the possibility of failure. It's part of innovating.
Precisely. And celebrating the small wins is so important. Recognizing and rewarding even small improvements. It can motivate teams to keep pushing those boundaries.
Creating a culture where innovation is valued and rewarded, even if it's not a major breakthrough.
Absolutely. Challenging the status quo doesn't always mean big changes. Sometimes it's about looking at things with fresh eyes, finding small changes that can make a big impact.
That continuous improvement mindset, always looking for ways to do things better.
Exactly. And all these 6 leadership traits we've been discussing: empathy, communication, problem solving, mentorship, learning, challenging the status quo, they're all connected. They work together to create a more effective and innovative healthcare system.
They're the building blocks of good leadership, not just in healthcare, but in any field. And in the last part of our deep dive, we'll look at how these traits work at different levels of leadership, from frontline managers to senior executives. Stay with us.
Welcome back to OneMedPro Pulse podcast. We've been exploring these 6 essential leadership traits for success in India's healthcare industry. We've talked about why they matter and looked at some practical examples.
Yeah, and in this last part, I think it would be good to see how these traits actually work. At different levels of leadership, that's a great idea. Because it doesn't matter if you're managing a team of nurses or a senior executive making big decisions. These principles can still guide you.
Exactly. Let's start with those frontline managers. They have such a crucial role, often interacting directly with both patients and staff.
Yeah, I imagine empathy is super important at that level, dealing with the daily realities of patient care and the impact it has on their team.
Absolutely. A manager who can understand and respond to their team's needs creates a more supportive and resilient environment. For instance, if a nurse is having a tough time with a case, an empathetic manager might just listen, provide extra resources, or even just acknowledge how hard it is.
Recognizing that healthcare professionals are human too, they need support.
Exactly. And effective communication is just as important for these managers. They need to convey information clearly, delegate tasks well, and address concerns quickly.
They're the bridge between upper management and the staff, making sure everyone's working towards the same goals.
Precisely. And they need to be good problem solvers too, able to think on their feet and find solutions to those everyday challenges that come up.
Sounds like a tough job.
It is, but so rewarding. Frontline managers can really make a difference for their team members and for the quality of care patients receive.
So how do these traits change as you move up in leadership? What does it look like to be empathetic, communicate well, and problem solve at a higher level?
As you go higher up, your responsibilities grow, but those core principles are still important. An empathetic CEO, for instance, might focus on creating a company culture, That puts the well-being of patients and staff first.
So it's not just about profits or numbers. They're thinking about the people.
Exactly. Their communication might be about inspiring their teams, sharing a clear vision for the organization, and getting everyone to work together.
And they'd use their problem-solving skills for bigger challenges like strategic planning, allocating resources, dealing with the healthcare system.
Precisely. Senior leaders also play a big role in mentorship. By mentoring those coming up in the organization, they help shape the future of leadership and make sure these values continue.
And by learning themselves and challenging the way things are done, they keep their organization at the forefront.
It's a journey of growing and adapting, no matter where you are in leadership.
It sounds like these traits aren't just for people with leader in their title. They're for anyone who wants to have a positive impact in healthcare.
Absolutely. Whether you're a doctor, a nurse, a student, or in administration, these principles can guide you.
That's a great message for our listeners. It's not about waiting for a promotion. It's about using these qualities every day.
Couldn't agree more. These traits help us build a better healthcare system, not just in India, but everywhere.
This deep dive has been so insightful. We've covered a lot, from empathy to challenging the norm.
Yeah, and we've seen how these traits matter at every level, from direct patient care to the top leaders.
So for our listeners,
Yeah.
wherever you are in your healthcare journey, we encourage you to think about these traits.
Think about how you can use them in your work, how you approach challenges, and how you grow professionally.
How can you be more empathetic with patients and colleagues?
How can you communicate better, making sure everyone understands even with different perspectives?
How can you solve problems with a focus on solutions?
How can you mentor and support others?
How can you commit to always learning and growing?
And how can you challenge the status quo?
Important questions for us all.
By embracing these traits, we can build a better future for healthcare, one that's focused on empathy, communication, innovation, and improvement.
Thank you for joining us for this deep dive into leadership.
And thank you to OneMedPro for the blog post.
We hope this was helpful, and we'll see you next time on OneMedPro Pulse Podcast.
Until then, remember to lead with purpose, with empathy, and a commitment to making a difference in healthcare.
Thank you for tuning in to OneMedPro Pulse. Let's make this a place where ideas flow, questions spark discussions, and every healthcare professional finds their voice. Thank you so much for joining us today on OneMedPro Pulse. We hope you found this episode insightful and valuable. Remember, this podcast is all about building a community for healthcare professionals, and your input is what keeps it alive and thriving. If you enjoyed this episode, please take a moment to like, follow, and share OneMedPro Pulse with your colleagues and fellow healthcare enthusiasts. Your support helps us reach more professionals like you and continue to create meaningful conversations. And don't forget to hit that subscribe button so you never miss an episode. Got a topic or question you'd like us to explore? We'd love to hear from you. Drop us a message on our website or social media. Your suggestions could inspire our next discussion. Until next time, keep making a difference and staying passionate about the incredible work you do. Now, signing off from OneMedPro Pulse. Stay healthy, stay informed, and stay inspired. Goodbye, and see you in the next episode